Let's talk about low libido. Low libido isn't a disease that can be cured with a quick injection or pharmaceutical. It can't be permanently solved by eating less or exercising more. It's a hormonal problem about 70% of the time. And that means that our bodies are trying to tell us something is awry. With a rigorous strategy, methodical, repeatable, scientifically supported, problems like low libido can be resolved. Most women are poorly served in the sexuality department. Don't know if you've noticed this, but it's definitely something I've seen over the course of my career. Unskilled partners, too many chores, women really carry the bulk of the emotional load in most households. And did you know that about 44% of medical schools have no formal curriculum on sex and how to take a sexual history? 44%! I think that's appalling. So doctors come out of medical school not knowing how to talk to you about sex. 43% of women are not satisfied with their sex life. 43%. A friend of mine, who was one of my chief residents when I was an intern, did this study. Her name is Jan Schifrin. She's at Massachusetts General Hospital. She looked at a total of 31,581 women. And she found that when you look from 18 plus, that 43% are not satisfied. They struggle. Female sexual dysfunction encompasses many different conditions that can cause personal distress. It can affect desire, arousal, orgasm. It can even cause pain. It's crucial to recognize that these issues are legitimate concerns, not something to be brushed aside or silent about or dismissed. Supporting a partner with low libido requires understanding, empathy, and open communication. It's essential to remember that low sex drive is not a personal failing or a lack of attraction. It can be influenced by various factors. So hormonal imbalances are probably the most common at 70%, but stress, relationship dynamics, trauma, underlying health issues also play a role. So let's take a closer look at the role of hormones in low sex drive. Research has shown that a significant link exists between low libido and imbalances in hormones like DHEA and cortisol. These hormones play such a critical role in our overall well-being, and they directly impact your sexual excitement and tension. Emotional intimacy and sexual neutrality are also interconnected, as unresolved emotional issues can lead to sexual problems. So let me tell you a little bit about DHEA and cortisol because there was a really interesting study done recently on this. So there's a woman named Rosemary Basson who's a professor at the University of British Columbia, and she's done probably the most important work when it comes to female sexuality. I can feel myself getting excited about this because I'm so passionate about it. So with DHEA and cortisol, she did such a critical study where she looked at salivary levels, so levels in the saliva of cortisol and DHEA. And here's what she found. This was published in Psychoneuroendocrinology in 2019. She found that DHEA and cortisol are critical salivary markers of low desire in women. So they're a sign that your control system, the hypothalamic pituitary adrenal axis, is not working the way that it should. And that can lead to decreased libido. So in this study, she looked at a total of 275 women. She looked at half of them with low libido and half of them with normal libido. And here's what she found. The women with low libido, which at the time was called hypoactive sexual desire disorder, more on that in a minute, those women had lower cortisol first thing in the morning. So they didn't have that full level of cortisol, which is supposed to reach a peak first thing in the morning. It was lower than that. They also had lower morning DHEA levels. And this was significant. So morning DHEA levels compared to the control group. they had a flat diurnal cortisol level. So remember, diurnal cortisol is kind of like a lasagna that opens first thing in the morning and then closes over the course of the day. And so these women would not open their lasagna very much. It would just open a little bit, and then it would close back up. So that's called a flat diurnal pattern. And that's the pattern that's associated with the most immune dysfunction. It's also associated with anxiety, depression, with fibromyalgia, with autoimmune disease, all of these conditions that can contribute to decreased libido. She found that women with hypoactive sexual desire disorder had lower CAR. Remember from our video on cortisol, CAR is the cortisol awakening response. It's one of the tests that I highly recommend. I do it on every single patient I see, male, female, etc. It's the cortisol awakening response. So your cortisol first thing in the morning, 30 minutes later, 60 minutes later. So women with low sex drive had a low CAR. And overall, what these results showed is that persistently low sexual desire in women is associated with dysregulation of the control system for sex hormones, with both cortisol and DHEA potentially detrimental to sexual desire. So when Rosemary Basson did this study, we called low desire in women, or low libido, hypoactive sexual desire disorder. Now that term has been changed. I think it was around 2020. They changed it to low sexual interest and desire disorder. They didn't consult me, so we can just call this low libido, but that's the clinical term that we use for it. So another point I want to make, again from Rosemary Basson, is that she's the one who published about how women have a different sexual response cycle than men do. For most men, sexual response starts with desire, and then it builds over time to reach climax, orgasm, ejaculation, and then there's the refractory period afterwards. That's called the Masters and Johnson approach to sexual response. And we also have these graphics in your workbook for your future reference. So this was studied in a lot of different couples, and it was assumed that what happens to men also happens to women until Rosemary Basson came along, and she actually presented a different model for what happens with women. And we're generalizing here, of course. Not all women fit into what I'm going to describe to you in a moment. But I think it's important to realize that women respond differently to sexual cues. So I want to start that off. Again, you're going to have this slide in your workbook. For women, the sexual response begins with emotional intimacy. Emotional intimacy. This is so critical for women. So critical for women. I want you to really get this, so pay attention. It starts with emotional intimacy. So this sets us up for such a disconnect because most men need sex to feel emotional intimacy. Most women need emotional intimacy to be open to sex. No wonder we have such a struggle between men and women and those who identify as male, those who identify as female. I'm talking here mostly about masculine and feminine traits. So for women, the first part of the sexual response cycle is emotional intimacy, and that creates sexual neutrality. So once you have this emotional intimacy, once that creates sexual neutrality, women then find that they're more receptive to sexual stimuli, more receptive. So I'm not saying they're swinging from the chandeliers. What I'm saying is they're more open, they're more receptive to the possibility of sex. And I can tell you, what creates emotional intimacy really varies from woman to woman. So some women need their partner to empty the dishwasher, maybe do the dishes for them to feel emotional intimacy. Other women need to be heard, listened to, seen, maybe for 30 to 60 minutes before they feel emotional intimacy. So we've got emotional intimacy, sexual neutrality, that then moves to being receptive to sexual stimuli. In her model, that then creates biological, psychological factors that influence the processing in the limbic system. And so, side note, if you've got problems with your DHEA and cortisol, you may not have the full biological factors that are going to make you process in the limbic system this openness to sex. That then leads to sexual arousal. So in the old model, desire leads to arousal, leads to erection and ejaculation, orgasm, then refractory period. For women, sexual arousal comes after all of these important points. Then you have more arousal and desire for more. This then leads to satisfaction that's physical and emotional. And that then creates more emotional intimacy and a sense of being open to sex. So I think it's really critical to understand that there are these differences between men and women. And it sets us up for such a disconnect in terms of what we want from sex and how open we are to it. So the more that those who are more masculine, men, those who are born male, can understand this about their women, the better. There's also this problem that I mentioned, which is female sexual interest and arousal disorder. So I want to show one more graphic, which is about the ways that this shows up. I want to give you the diagnostic criteria so that you know what doctors are looking for. And then I'm going to talk about some of the medications that cause low libido. We'll get to that in just a moment. So these are the diagnostic criteria that we look for in diagnosing someone with female sexual interest and arousal disorder. Lack of or significant decrease in sexual interest in at least 3 of the following factors. Number 1, interest in sexual activity. Number 2, sexual or erotic thoughts. Number 3, initiation of sexual encounters and responsiveness to a partner's initiation. Number 4, excitement or pleasure during all or almost all sexual activity. Number 5, interest or arousal in response to internal or external sexual or erotic cues, written, verbal, visual. And then number 6, genital or non-genital sensations during sexual activity in almost all or all sexual encounters. So that might sound like an earful. I encourage you to look at the workbook to really understand these different factors, especially if you feel like you might have 3 or more. Importantly, these symptoms need to persist for a minimum of 6 months and cause clinically significant distress in an individual. So these criteria from the American Psychiatric Association as well as the American College of Obstetrics and Gynecology. So in terms of some of the common causes, medications are one. So I want to get into some of the medications that cause low libido. And you want to consider switching together with your clinician if you're on one of these. So the first is hormonal contraception. I don't know about you, but I was on the birth control pill for about 10 years. And I remember when I was on the birth control pill, I felt this irony. I was on the pill to have sex, and yet being on the pill decreased my libido. It just felt like, what fresh hell is this? That makes no sense. So the birth control pill is a really important cause of decreased libido, and millions and millions and millions of women are on it. And mainstream physicians are prescribing it later and later and later for women as a way of dealing with perimenopause and menopause, which I think is a bad idea. That's why I'm so excited you're in this class, because you're learning the alternatives to that kind of knee-jerk response of a mainstream doctor who's saying, oh, you've got hot flashes and night sweats, let me give you this birth control pill. You go home and then your sex drive tanks. Another important class is psychiatric medications, especially antidepressants. They can affect interest, but also your ability to orgasm. Anti-seizure medications, antihypertensives, which people take for high blood pressure, cholesterol-lowering medications, sleep medications, pain medications, anticholinergics, such as people with Parkinson's take, HIV medications, hormone blockers like GnRH agonists, aromatase inhibitors. People take that for the GnRH agonist for endometriosis. And then very importantly and very commonly, alcohol, cannabis, and narcotics. So many doctors recommend having more sex, especially the prominent male doctors and authors who are advising women on how to cope with low libido. This advice is just plain wrong. It's patronizing and it's not right. So don't tell a woman with low sex drive to just buck up and have more sex. Low sex drive is a couple's issue. Blaming the woman and bypassing the root cause without considering the relationship issues leaves women cold and misses the point. So let me pause here. I want to talk about some of the most common causes of low libido and also risk factors. So we mentioned some of these. I just want to get it all in one place for you. So anxiety disorder, diabetes, depression, female genital mutilation. Side note, the birth control pill can shrink the clitoris by 20%, so I would put it in that category. Genitourinary syndrome and menopause. That's when things become more dry in your vulva. History of sexual abuse, really important. So make sure you got that ACE questionnaire score. Hypertension, high blood pressure. So your vasculature doesn't work normally, and so you don't have the normal blood flow to your genitalia. Hysterectomy. We talked about how that changes blood flow. Even if you have your ovaries left, you can change the blood flow to your ovaries just by taking out the uterus, even a partial hysterectomy. Intimate partner violence. Medications, as we just talked about. Negative sexual attitudes. A lot of people grow up with a lot of shame around sex, and that's something we have to unlearn. Neurological disease. If your nerves don't work to your clitoris, it's going to be really hard to enjoy sex. Personality traits like perfectionism and self-dislike, self-loathing. The postpartum period. The postpartum period is like a preview of coming attractions in perimenopause and menopause. A lot of women don't realize that, but they have a baby, they're breastfeeding, they're having hot flashes, night sweats, and sex is the last thing on their mind for months, sometimes years. Premature ovarian insufficiency or failure. The psychological sequelae of gynecologic cancer and breast cancer, especially if you have a history of breast cancer, you get a big surgery on your breasts, and then you get started on something like an aromatase inhibitor that basically removes most of the estrogen molecules in your body. Relationship discord, so critical. Stress, emotional or environmental stress, urinary incontinence, and also substance use disorder. So if you struggle with low libido, I strongly recommend that you work with a clinician and do some testing. This is a more advanced topic, and it's where working one-on-one can be extremely helpful. You deserve an amazing sex life, and you can have it if you want it. So don't close the shop too early. If you think your libido is gone for good, know that that's not the case. There are so many ways to get it back.